don't text to you? Is it written text?
Yeah, get to the clerk right there.
Yeah.
Thank you. Next panel is Sheridan Wade, Vicki Laymeyer, Diane Kosta, Grace Chimene, and Patty Wells, as well as Alana Strong. They will be followed by Bob Bagley, Nicholas Smedra, Kathleen Wall, Evelyn Zhang, Carol Cole, and Lisa Cope. Start off with Sheridan Wade.
That's me. Okay. Hi, I'm Sheridan Wade, and I am here representing myself in support of SB1. This is not a political issue for me or religious agenda, which I've heard over some of the testimony. I want you to know that I've been on both sides. I've worn orange and I've worn blue. I am a post-abortive woman, and my job and passion right now is getting to serve women in a pregnancy center. I was here last week and this week and getting to hear a lot of jargon about how this bill would limit access to health care or close clinics. I'm originally from Lufkin, Texas, which is a southeast Texas, Senator Nichols, and that's one of the rural areas within discussion. However, the bill does not close the clinics, nor does it access health care. It's a choice. If there is a new standard, a higher standard in which any clinic does not choose to rise, that is when the clinic will close. Whether it's a new standard for legal that Senator West would have to meet in his practice, and being able to see that, although I'm only 34, my daddy thinks I'm pretty precious cargo and worth protecting, as I do the women that we serve. We just served our 60,000th client since 1984. That's post Roe v. Wade. We see everything from hemorrhaging to, infertility to women who are grieving or depression and coming, and mostly unreported. I also heard about that, whether it's from fear or lack of knowing how to do the process. And I am urging you to please be in favor of SB1 for a higher standard for excellence of care being on both sides. I would want it whether I'm a patient or the women coming after me. I've been there on both sides. I understand how wonderful it could be for the women. Thank you.
Vicki Laymeyer. Vicki Laymeyer. 1, 2, 3. Okay, I'm missing somebody. Diane Kosta.
My name is Diane Kosta. I am a constituent of Senator Jay Nelson. I'm speaking in favor of the Senate bill, and I'm speaking for myself. I'd like to read a portion of a 2008 study from Reproductive Health Matters, Complications After Second Trimester Surgical and Medical Abortions, and it was authored by OBGYN specialists from Stanford and Massachusetts. The mortality rate with abortions performed at 8 weeks or earlier was 0.1 deaths per 100,000 legal terminations, and the rate increased to 1.7 deaths per 100,000 abortions performed at 13 weeks. The mortality ratio for abortions performed at 16 to 20 weeks was 3 deaths per 100,000 procedures and 8.9 deaths per 100,000 abortions for those 21 weeks or later. Although the absolute risk of death was low, the relative risk of death with an abortion performed at 21 weeks or later was more than 75 times higher than the risk associated with abortion at 8 weeks. In the series, 85% abortion-related deaths were due to direct causes, primarily hemorrhages and infections. So we need to understand the bill, what it is and what it isn't. Abortion is legal in Texas. We're talking about 5 months and under is legal. There's compensation for severe fetal abnormalities to avert the woman's death. As a former mayor, we all know that people that are opposed to things come out in masses more than people that are for things because they're louder does not make them the majority. I believe I speak for the majority of the women in Texas. As the wife of a physician, I want the best health care. As a Latina, I am tired of people speaking for me and my people. I am a Latina. I don't want people talking about minorities to promote their agenda. We're smart people, we Latinas and blacks. We know where to go for health care, and stop trying to promote your agenda. Those clinics are not going to close. You know it. and we know it. So stop the smoke and mirrors.
Okay. Grace
Shemaine.
Thank you.
Thank you. I'm Grace Shemaine, and I'm speaking for the League of Women Voters, and then afterwards I'll speak really quickly for myself. In opposition for Senate Bill 1, I live here in Austin. The League of Women Voters is a nonpartisan political organization with about 2,000 members across the state. Women's health and access to safe legal abortions is very important to our members. SB 1 has harmful mandates. One would require a physician performing an abortion to have active admitting privileges. This requirement is unnecessary because hospitals already must admit all patients needing emergency care. Number 2, SB 1 would require physicians to administer in person 2 medicines used for drug-induced abortions and to see patients again within 14 days. This is making it more difficult for women, especially those living in remote or underserved areas, to obtain abortions legally and safely, and increases the likelihood that they will have to resort to illegal and unsafe procedures. Number 3 would require facilities to become ambulatory surgical centers. The true intent of this regulation is to make unaffordable demands on providers and thus bring about the closure of facilities. The League of Women Voters urges senators to not vote for that. My personal testimony: I'm a pediatric nurse practitioner and I oppose SB 1. Teens are especially at risk for choosing dangerous, medically unsafe alternatives to continuing a pregnancy if costs are high, transportation is difficult, or support is not available. I would also like you to consider the lack of safe medical services for teens with incredibly difficult medical, social, and economic situations. Pregnant children, rape, incest, child abuse, intellectually disabled girls, mentally ill teens are not considered in this bill. Please vote no for SB 1 for the safety of children and teens and women of Texas. Thank you.
Thank you. Patty Wells.
Oh, yes. I'm Patty Wells from College Station. Dr. Schwartner is my senator, and I stand in favor of Senate Bill 1. A couple of notes. I read on a pro-abortion website, I don't have the documentation with me, that only 2% of abortions are performed after 20 weeks, so this is not a whole great big load of abortions we're talking about to begin with. And also that Roe v. Wade allows state legislatures to restrict abortion after the first trimester, whether there's pain or not. So I think we're being much more generous in this bill than even Roe v. Wade. I wanted to talk about 2 things. First of all, although abortion is relatively safe and legal, there is damage to women that we don't see on the surface. A lot of studies that I have documented here show that there's a survey of post-abortion women that found that 28% had attempted suicide, 31% experienced suicidal feelings. Many of them have post-traumatic stress syndrome, and additionally a study in Finland, the Stakes study, showed that 4 times as many post-abortion women died the following year as a result of everything from suicide to accident to anything else, as opposed to women who had childbirth or natural miscarriages. The other persons I want to address are the babies. Whether or not they feel pain at 20 weeks doesn't really matter so much. Just once they're aborted, they're not going to feel pain or love or joy or anything else the rest of their life. God told Jeremiah, before I knitted you together in your mother's womb, I knew you. And in Ephesians 1:4, Paul says that we were chosen before the foundation. Before God created the universe, He chose us. And
Thank you.
Everybody.
Ms. Strong.
Thank you for allowing me to speak to you today. My name is Alana Strong. I live in University Park, Texas, and John Corona is my senator. I represent myself and my husband. I'm a homemaker, a mother. I have 3 grandchildren, all planned, all wanted, and I love children. It's precisely because I love my children that I oppose Senate Bill 1. Senate Bill 1 would do nothing to improve their lives. It would do a lot to make it much worse. Limiting choice without providing alternatives or funding for alternatives is always a bad idea. Increasing regulations which have been identified by experts as being unnecessary, is not the answer either. Please listen to the AMA, the TMA, the TBA, and other intelligent groups who oppose this bill and do not support Senate Bill 1. Thank you.
Thank you. Again, is Vicki Laymeyer here? No. I'm going to show that individual who had registered to provide oral testimony in opposition to the bill now registering a position but not providing oral testimony. Thank you to this panel.